Well, this raises issues of enforcement and compliance. On 26th of April, the Health Ministry released a statement directing everyone to wear a mask. In that statement, they quoted portions of the Public Health Act that provides that the Minister of Health may order an individual to take a preventive measure in respect of public health matters. So why are we unable to enforce this? In talking about face mask and its enforcement, you also recall that the Ashanti Regional Minister Simon Osei-Mensah gave out a directive asking people to wear them or face sanctions. Listen to him a few weeks ago.
Close of day tomorrow, the following day, we are going to be very strict because everybody should be able to acquire the face mask today and tomorrow.
When you say being strict, what do you mean by being strict specifically?
If we see you maybe without face mask and you are in public, we can return you to go back home until you get the face mask on.
So that would be the Ashanti region's measure to contain the spread.
Yes, that's what we are going to do, and especially in the market areas and areas where you have large crowds.
Let's speak with my colleague Ohime Nteria, who's been following this issue of face mask for us in the Ashanti region. Ohime, are people complying with the guidelines in the Ashanti region?
Yes, Aisha, I would say the directive has been adhered to by residents of Kumasi from day one when Dr. Michael Owusu, virologist at KCCR, first made a suggestion to the health ministry and government in general to implement wearing of nose masks. And in that interview that we had with him on Joy News, he specifically stated that wearing of nose masks shouldn't be an option, but it should be mandatory for all Ghanaians as far as measures to curtail the spread of COVID-19 is concerned. And a day after the advice, the Ashanti Regional Minister, Simon Osei-Mensah, who spoke to my colleague Nana Yaojima, stated that the Regional Health Directorate and then the RESEC has also adopted the measure and insisted that henceforth from 21st April, everybody, especially those who visit public places, should be in nose mask. And since then, almost everybody that you see on the streets of Kumasi or in the Ashanti region is in nose mask. I must say compliance has not been 100%, but comparing what I have seen in Ashanti region to parts of Eastern region that I visited just this morning, the indication is that the compliance level in Ashanti region is very high. It's very, very high. Everybody that you meet on the streets of Kumasi has a nose mask on him or her.
Hearing from the minister, you sense that he was very worried about the people in the market. How is the compliance in the market?
For the public places, especially in the markets, some visuals that we just shown from the Ejuso market is one of the most patronized markets in Ashanti region. The traders, they themselves have formed a task force. So the no mask, no entry directive is working perfectly in the Ejuso market. If you dare enter the market without a nose mask, the task force will just force you to go back and come back later in a nose mask before you are allowed to trade, either to buy or to trade your wares in the market. In the Asokore-Mampong municipality, for instance, the Asokore-Mampong market where we visited, the story is not different. The traders, everybody you see in the market is actually in nose mask. In that particular market, the issue was that some of the patrons who visit the market normally comes to the market without their nose mask. And when you question them, they have the nose mask on them, but at some instances, they were not wearing the nose mask. But I must say, henceforth, with the support of the municipal and district task force, there's no police or military involvement. It's being civilians who are enforcing these directives. People have adhered to the no mask, no entry in public places, and even on the streets, you see people in their nose masks.
So the compliance has generally been good. Grateful for the update. Ohime Nteria is with our help desk.